Hello, welcome back to my channel. My name is Radhika. I'm a second year medical student at Queen's University Belfast, and today I want to talk about how to ace your first year of medical school. So I found my first year of medical school a bit, up and down. First semester was kind of really difficult because I was settling in, I didn't know how to make notes, there's not a very good work-life balance. Second semester though, I found my feet and I ended up doing really well in my exams. So hopefully all the tips I share in this video will help you guys. I'm going to split it into 3 parts. Like part 1 is going to be just like general tips, part 2 is about anatomy, part 3 is about OSCEs. So I hope you guys enjoy and let's get started. First tip is to split lectures with friends. My friend and I did this last year and now that same friend is my flatmate. Crazy. Basically what we did was, let's say you have 6 lectures in a week. 2 are anatomy, 2 are pharmacology, 2 are physiology. Now you want to split the lectures based on your strengths. So for example, I would take the pharmacology lectures and then one of the physiology lectures because I'm very good at pharmacology. I'm not so good at anatomy, therefore I would let my friend do those ones. And we would go off, we would do these lectures, we would make notes on them, we would make Anki flashcards, and then we would share our resources with each other and we would teach the content to each other. And this dramatically reduced my workload because I already had notes made from those lectures in a very easy, very condensed format, and it meant then that I wasn't spending as long going through the lecture. I could just learn the key points from each lecture, and it also meant that when you're teaching someone else, you have to show up. I felt like I was held accountable because I knew that if I don't do these lectures, not only am I not going to get any use out of it, but neither is my friend because she's relying on me to show up as well. I thought that it helped us also get closer as friends, and it was also a very efficient way of studying. The second thing is to practice preclinical questions. So unlike A-levels where there are so many different resources, there aren't in medicine, or at least there aren't many good ones. I used Past Medicine and I used QuesMed. I have a discount code for QuesMed. You can use the code on screen or use my code RDT10 for 10% off your QuesMed subscription. But I really loved QuesMed. It really helped because they have a preclinical section, meaning that I could just test myself on all the content I was covering in lectures. I also think the best thing to do is to save your wrong or incorrect answers into a big long sheet and then write to learn. That's what I do, so then I know that okay, I have to come back on that because I didn't understand that. And so it really helps because you're constantly actively learning and testing yourself. I would recommend maybe doing, let's say, 25 to 30 questions at the end of the week in November, December, January, and then kind of in the lead up to your exams, obviously build up. You can also do it with friends. That's a really good way of studying. What we would do is we would maybe take 1 hour in the library and we would all just go around doing questions, and then if the person got it wrong, they had to explain why they got it wrong. So you have to understand the content really well, and it helps a lot for exam revision. Number 3 is super important, and that is to remember the bigger picture. Remember, you're not just learning isolated topics. Just because you have a lecture on one thing, it doesn't mean that's all you need to know. You need to be able to create links between your lectures, and the best way to do that is to either use a whiteboard or to use a mind map. So whenever I would make a link between a topic, it's really funny. I would just say the word link and my friends would know, okay, she's gone crazy, but she's made a link between a topic. And that's how it stuck in my brain. Every time I made a link between one topic and the other, I would just say the word link. And I found it really, really helpful, especially when it came to learning content. I feel like because I was grouping my lectures together and I was doing them in an order that made sense to me, it meant then that the content logically fit in my brain. And it's not like I'm doing isolated topics. It's okay, it's logically flowing. Focus solely on your learning outcomes. I think for second year, you have to kind of read a little bit beyond the learning outcomes. But I think for first year, just focus on the learning outcomes and that is it. Try and make multiple choice questions based on what your learning outcomes are describing, and remember the learning outcomes are what you're tested on. What I would do is I use OneNote to make my notes, so I would paste all of the learning outcomes onto OneNote, and then underneath each one I would highlight the learning outcome in yellow, and then I would make notes. And then on OneNote you have this feature where you can do a plus thing, so you can kind of make it so it hides the content underneath. The other thing I would do is I would constantly try and make active questions so that I'm testing myself. So for example, a common question that I would make would be, what is the mode of action for the drug amlodipine, and then I would have to describe that. And the key thing then is that you're understanding, okay, this is how the drug works, this is where it's treated, this is where it's contraindicated. Those are all the things to remember. I think another thing that you could do with learning outcomes, and is this the greatest tip? I don't know, but it really helped me, and that is to use ChatGPT. AI features I think are now on Quizlet, they're also on Notion, so you can do them there. But basically what I would do is I would paste the learning outcomes onto ChatGPT, and then I would say summarize this information in a table, and it would do it for me. And ChatGPT is pretty good for some things, not so good for others, but I do think it's good for condensing things down and just kind of honing in on exactly what you need to know. Okay, now I want to talk about anatomy. This is everybody's favorite or least favorite subject. I have a love-hate relationship with anatomy. I like it, but I think it's very difficult. I think the easiest way to learn anatomy is to download the images that you're given onto your laptop and then go into Word and cover all the labels with text boxes that you can type into, or maybe just like highlight over them so that you can then like sort of guess them, like play it like a guessing game. I think that really helps. Anki has a really good image occlusion feature where you can download images and then you can cover them, and it's again like hide one, guess one. I used that a lot last year and I found it really helpful. I think with anatomy though, it is all just memorization, and with anatomy you have to do it consistently. Like I think last year when I was a first year student, I found anatomy really difficult, but a large part of that was because I was inconsistent, whereas this year I'm trying, not very well, but I'm trying to do it a little bit more consistently so that it's staying in my brain, because there's so much to learn. I would really recommend buying those large anatomy posters and putting them around your room so that you're kind of like seeing it as you go in and out, and it'll help. Like anything small helps in the long run. The other thing I would say with anatomy is that try and find one or two good books to use. So I personally use McMinn's Color Atlas, which is the cadaver one. I use Grey's Anatomy from time to time, and then I like to use KenHub or Geeky Medics as well, just because I like when I'm making my notes I need images to refer to, so I would just use images of KenHub, and KenHub has a page on practically everything. No matter how small the artery is, there is a page on it on KenHub. Also remember to look at images in different planes. Don't just be looking at images in one plane. You gotta get used to seeing images in the sagittal plane, in the coronal plane, in the transverse plane, because the more images you see, and it just becomes easier to orientate yourself, and it overall means that you're becoming a better medical student because you're able to identify things faster. I want to talk about OSCEs. I think in first year, I made a whole OSCE vlog by the way, but I think in first year one of the big things I did was I neglected my OSCE massively. And did I do very well in my OSCE? I did not do very well in my OSCE. I thought I did, but contrary to what I thought, I didn't. And I think a large part of that is because I did not do nearly as enough practice as I should have. I don't know how many medical schools do OSCEs now, or at least like OSCEs in first and second year, but my medical school does them in first year. And so if you're from my medical school, you might want to listen up. I think with OSCEs, just do practice. As much practice as you can, but more importantly, practice early. Don't leave it to like 2 or 3 weeks before the exam, because I don't think that's enough time. I think especially when it comes to certain skills like blood pressure, you gotta be consistent with it because it's all like technique based. Try and go into your clinical skills experience classes with the knowledge you need to be able to do well in the class. Treat those clinical classes that you have as like a revision session, not a session where you're learning things. No, this is a session where you get to hone in on skills and kind of learn what you don't know so that you don't make those mistakes in your OSCE. At least that's what I've been doing this year, and I found myself actually really enjoying like my clinical skills, whereas last year I hated it. Definitely do the prep work before you go in for them. I didn't do the prep work all the time last year, and I definitely think that impacted why I was just so stressed out for my OSCE. With OSCEs as well, a really good way to do it is put all the OSCE stations onto like Quizlet or onto a PowerPoint and shuffle it so that you're kind of just getting different slides each time. I mentioned this in my MMI video as well, but it basically means you're like forced to go from one side of your brain to the other, and it kind of mimics like the stress of an OSCE. One of my friends was telling me that she and her friends do sloshkis, where they basically do OSCEs and then they do a shot every time they miss something. I don't think that's a really good way of learning. I think it's a fun thing though to be able to like do something like that with friends, but OSCE practice definitely does like make you closer as a friend group as well. So I've covered basic tips on how to do well in first year. We've gone through a bit of anatomy. I've talked about OSCEs. The last thing I want to talk about is the importance of actually doing things with your time. I think one of the big mistakes I made in first year is I was not involved a lot in university life. I am a student ambassador and I was in first year as well because I did the program in first year, but I didn't really engage with it. Another thing I didn't really do in first year is go for societies until later on in the year, and I definitely do regret that now, because now I'm like wanting to do more things, but it's like there aren't enough hours in the day to facilitate that. You are first year once. Definitely do utilize your time well. Try and find 1 or 2 societies that you're interested in, and definitely get involved in medical societies, especially closer to exams, because they always run revision nights. I think that if I could go back in time and tell my first year self something, it is that you do not have to study all the time. Try and study maybe 2 to 3 hours a day, and then the rest of the time use to spend with friends, because once you go on placement, you're not going to be seeing your friends as much. I would dedicate one day to going out with my friends, and that would usually be a Thursday. So today is Thursday, so I'm going out with my friends. And the reason I would do Thursdays is because my timetable wasn't that heavy, but also because I knew that, okay, after let's say 6 or 7 o'clock, I am closing my books and I'm going out with my friends and I'm going to enjoy myself. And that's what you have to do. Find that one day that you can just relax on. Finally, remember, medicine is a part of your life. Medicine should not become your life, because when medicine becomes your life, it means it becomes a chore, and it shouldn't be a chore. You want to be able to enjoy your course, and you want to be able to obviously take pride in doing your course, and your course should be an important part of your life, but it's a part of your life. It shouldn't define you as a person. Any person I've spoken to that says that all they do is study, they don't look happy. But the people that I know who are actually happy are the ones that have tried to find a work-life balance. Remember, work will always get done, and work expands to fit the time that you allocate for it. So if you're blocking off time to do activities with your friends and you've only got certain windows to study in, it means you're going to study more intensely and you're going to have like a better outcome, because it's quality over quantity. And that's just a thought I want to leave you guys with. Thank you so much for watching this video. I hope this video was helpful, and I hope this video has like maybe just eased your mind off first year a bit, or it's like given you some things to think about. If you have any questions, please leave them down below, or just DM me on Instagram and I will answer them. Thank you so much for watching. Please stay safe, and I will see you very soon for another video. Bye.